Hi guys, this is Ashik from Physio Vibes Anatomy. Today the topic of discussion is rotator cuff of the shoulder. Rotator cuff of the shoulder is the musculotendinous covering which is present around the shoulder joint. This is a shoulder joint, the glenoid cavity of the scapula articulating with the head of the humerus. So this muscular tendinous covering is formed by the tendons of four important muscles in the shoulder region. These muscles originates from the scapula and inserts into the humerus. These muscles are very important because it plays a very important role in stabilizing the joint. Actually, we can look here, this is our shoulder joint. The shoulder joint is the flexible joint in our body, the most flexible joint in the body, because the head of the humerus is too long and big than the glenoid fossa. This is what the glenoid fossa, which holds the head in place. So because of this, we can have here the greater mobility than any other joint in the body. So this allows us making some extraordinary movements like gymnastics and even swimming, playing tennis, etc. So this greater mobility comes at the expense of stability. Yes, the joint is very less stable. So these musculotendinous muscles and tendons, this rotator cuff helps in maintaining the stability of the shoulder joint. So here in this video, we are going to see about the rotator cuff, and in exam point of view, this is very important 5-mark question for physiotherapist. So here we see, before we begin, let me give you a quick overview of what we are going to see now. So here is the outline or overview of what we are going to see. This is, first we'll be seeing the introduction, then muscles forming the rotator cuff, their origin, insertion, then nerve supply and function. Finally, I'll give you some clinical notes about the rotator cuff and we'll end. And guys, now we are going to see the muscles which forming the rotator cuff. As I said, these muscles will be originating from the scapula and inserts into the humerus. And these muscles are the supraspinatus, infraspinatus, teres minor and subscapularis. So let me show you in the picture. So this is the anterior view of the shoulder joint. This is the anterior surface or costal surface of the scapula, head of the humerus. This is the lesser tubercle of humerus, anterior view. So the one of the muscles of the cuff, which is subscapularis, which is arising from the costal surface of the scapula, and it will be inserting in the lesser tubercle of the humerus. And the remaining three muscles, which is supraspinatus and other two muscles, will be coming from the posterior surface. This is the posterior view of a shoulder joint. This is the posterior surface, and in the scapula, the posterior surface is divided by upper and lower spaces, which is the thing which is separating upper and lower is the spine of scapula. So from the upper portion, the muscle supraspinatus, which we saw here, the supraspinatus comes and inserts into the greater tubercle, and from the lower surface, the infraspinatus muscle comes and inserts into the middle facet or middle impression of the greater tubercle. Then in the lateral border, from the lateral border upper 2/3, the teres minor muscle goes and inserts into the lowest impression on the greater tubercle of humerus. This is the greater tubercle of the humerus. So now we are going to see the origin, insertion, innervation of each muscles. And first one, we are going to see about the supraspinatus muscle, and this muscle originates from the supraspinous fossa, which I said here we can look, and the posterior view of the scapula, the upper portion, this portion in the scapula is called the supraspinous fossa. From here the supraspinatus muscle comes and it originates from here, hence the name supraspinous fossa. And the insertion is upper impression of greater tubercle. Here in the greater tubercle, there are three facets, upper, middle and lower facets or impressions, where the supraspinatus and other two muscles gets inserted. Let me show you the picture of great tubercle. And guys, this is the greater tubercle of the humerus. Here is the upper and middle and lower impressions or facets for the muscles to get inserted. Here you can, in this picture you can see even clear the highest impression and the middle impression and the lowest impression. Now the supraspinatus gets inserted here, infraspinatus inserted here, and the teres minor gets inserted here. And here the lesser tubercle, which is facing anteriorly, where the subscapularis muscle will be coming and inserting there, which we'll be seeing later. Then the nerve supply. The nerve which supplies the supraspinatus muscle is the suprascapular muscle, which comes from the root value C5 and C6, that is from the upper trunk of brachial plexus, which we'll be seeing while we study the nerve. So finally, the important thing is function of the muscle, action. This supraspinatus abducts the shoulder. So this muscle abducts the shoulder along with the deltoid. The deltoid muscle will be coming from here, the acromion spine, and from the anterior surface of the clavicle. So along with deltoid muscle, supraspinatus helps in the abduction of the shoulder joint.